it may take many years for the economy to recover fully. But I think what's most important to people's lives and the health of the nation. For me, as a doctor, of course, I would say that, but for me, it comes first.
You must stay at home.
Whatever it takes.
We will beat the coronavirus, and we will beat it together.
Welcome back to Ask Dr. Hilary Coronavirus Explained. Now, today we're going to be talking a little bit about the UK's approach versus other countries' approaches. Now, we've obviously been in lockdown for a few weeks now. We've seen the virus, cases continuing to rise. We've seen a kind of sort of fluctuation in deaths as well. How do we know, or when will we know the UK's approach has been the right one?
Well, we'll compare our progress to other countries around the world. Other countries have different populations, different demographics, older populations, younger populations, urbanization, healthcare systems which aren't as developed as ours, and people using different approaches. So it'll only be by looking back that we'll see who was right to put lockdown in place when we did. Who was right in testing at the early stage and doing contact tracing, who was right to use which medications and at what time, which countries fared better because they had more resources at the outset in terms of intensive care and staff. So I think it'll be some time before we can compare our approach, but by and large I think our approach has been very sensible, very measured, based on evidence, on clinical evidence, and I think that we now rely on the public and everybody to follow the guidance that's been given, because it's about human behaviour that will control this virus whilst we wait for vaccines and more effective treatments.
I want to get your take on the supposed fight between the Treasury and the Health Department. Now, there's obviously been newspaper reports of a bust-up between Rishi Sunak, the Chancellor, and Matt Hancock, the Health Secretary. Basically, the Treasury is saying, look, this is causing such a big economic hit on the economy. We need to know when the lockdown is going to end. And the Health Secretary is saying, well, actually, we need to continue with this lockdown sort of indefinitely, because we don't know when death's going to stop. We don't know when the virus is going to peak. So we need to sort of continue this. What do you make of that kind of fight?
Well, I understand that there is a danger if the economy sinks too low to people's health, just in terms of if the country is bankrupt, then that has health implications, particularly for the very poor, for the unemployed. I understand that, but first of all, we've got to get out of a situation where our National Health Service is in dire straits, overwhelmed with the number of patients coming in. We can't even begin to pick up the economy when we've got such a sick nation, a potentially sick nation. And health must be the priority. I don't think any government will ever be forgiven for not putting health at the very top of their priority if they do that over the economy. The economy, the country will pick up in time, and it may take many years for the economy to recover fully. But I think what's most important to people's lives and the health of the nation. For me, as a doctor, of course, I would say that, but for me, it comes first.
And finally, I want to talk a bit about Sweden, because they've taken a completely different approach to most countries to the coronavirus pandemic. Now, they've basically taken pretty light steps forward. They've banned gatherings of more than 50 people. They've told people to stay at home when possible. They've told vulnerable people over 70, to self-isolate. But people, by and large, are sort of continuing as normal. Are you worried this approach is likely to lead to a kind of disaster or catastrophe later down the line? Or have we made the wrong decision by going into lockdown?
Well, I think that in Sweden they're having a big wobble right now. Currently, that they have been doing exactly what you described: people going to bars and restaurants and socially distancing themselves. But they're 2 weeks behind our curve, and I think they're now becoming quite worried about the increasing number of cases that they're beginning to see. And actually, this virus is not going to behave any differently in Scandinavian countries than it does anywhere else in the world. The virus is very transmissible. The population are just as susceptible, and I think they will regret not being a little bit more disciplined in keeping people apart. And restaurants and bars, when people socialize like that, the virus spreads. And it remains to be seen whether they were right and we were wrong, but I suspect that they will be copying us and having a more disciplined lockdown quite soon.
Right, let's go to the first of your questions, which is a video question from Michael Revel.
Dr. Hilary, do we know if you can catch coronavirus again? If not, can our antibodies be used to possibly find an antidote for this horrible virus?
It's a good question. We don't yet know whether you can catch coronavirus again because we don't know how long immunity, such as it is, will last. It is our hope, of course, that people who have had coronavirus will be immune for many, many months, if not years. But we can't rely on that. And evidence from the past has shown that the viruses that cause pandemics can return either in a mutated form, either better or less strong, stronger or less strong. And they can return to people who've got some immunity, and that immunity can actually cause an exaggerated response. So that remains to be seen. In terms of using people's antibodies, that's a good question because that we can use people's antibodies, for example, in hepatitis B, to help people, to give them passive immunity. But of course, that is very, very labour intensive. It means taking serum from people who are immune and then using that serum to give to individual patients. That's painstaking and laborious, and it would be much better if we had a vaccine where we can give everybody an antigen which is altered so that it doesn't give you disease but gives you immunity.
Following on from that, I know you talked a bit about the virus could get stronger or weaker. Am I right in saying that generally these kind of viruses mutate and they get weaker just generally out of the history of viruses in the world?
Yes, that's usually the case, that they seem to lose their virulence for one reason or another. If you think about it in evolutionary terms, a very powerful virus doesn't do itself any favours because if it kills too many of its hosts, it can't survive outside of the host. So a virus that perpetuates is usually a more moderate virus. It's an odd way to look at it, but on the whole, viruses become less virulent, which is why we don't see pandemic viruses recur year after year after year.
We'll go on to the next question. This one's from David Finch. Now, he asks, there's a lot of talk about using other drugs to treat COVID-19. With so many deaths, can we not just try these and maybe save some lives? Why is there so much red tape?
Well, if you give someone who's quite sick a drug that makes them worse, you're doing more harm than good. And the implications of that are horrific. So we have to use, even on a trial basis, medicines that are monitorable and considered to be safe. Now, we hear a lot about the trials that are being done right now on dexamethasone, a steroid, hydroxychloroquine, which is thought to be effective in the early stages but could have quite toxic effects in people whose liver or kidney function is low. And also we're looking at drugs that we've used for HIV in the past. But we have to do these with patients' consent. We have to monitor them very carefully and compare them to control groups who aren't giving any medicines at all. We have to look at those three types of medicine approaches, see who fares best, and it takes time. You can't just guess. It has to be done in a controlled way so that we can get the information we need to help the majority of patients.
So question 3 is from Julie Davis. Now, she asks, what happens after we've all been in lockdown? Do we go and venture out and go back to normal? Now, this is a funny question. Are we all going to go back to the pub and have a big celebration, or will that just cause the virus to spread sort of thing?
Yeah, it would cause a second peak quite quickly because obviously there's going to be lots of people who haven't been exposed to the virus, and we just go back to square one and we're wasting all the sacrifice that we've currently made. So when lockdown comes towards an end, it'll be de-restricted on a gradual basis and a logical basis, so that some sections of people will be allowed to return to their normal activity. It may be that schools, for example, go back to starting up first. but I don't think people will be encouraged to go straight back into cinemas and theatres and bars and restaurants, because that's where they congregate in close proximity, and that's how the virus spreads, and we don't want that. So I think it'll be a gradual de-restriction of lockdown, rather than everybody opening their doors and singing and dancing and going back as if nothing's happened. That would be a major mistake.
So we might have to wait a bit longer to go for our pints then.
I'm sure we will. Yeah, absolutely.
The fourth question is from Andrew Jarvis. Now he asks, is there any country anywhere finding a vaccine? Why do we not hear anything about a cure, just prevention and treatment?
Well, we're looking for a vaccine. That's the if you like, that's the thing that we all praying for, but it's hard to make a vaccine. You've got a little bit of a protein molecule surrounded by a fatty protective layer. How do you make the body respond to that, to produce antibodies to that? We know that there are some microorganisms where it's been very difficult to produce a vaccine to mobilize the human body's antibody system into producing a response. So all around the world, people are looking at this. We know a little bit about the coronavirus. We can look at its genetic material, but we need to find something that antibodies can lock onto, like a key in a lock, and kill off that virus. But I can tell you that people are working around the clock all around the world to find a vaccine, and I am confident that we will. But it's going to take time. We then have to prove that the virus is safe to use, and we need to then find out who's most vulnerable and produce enough vaccine to give them the vaccine first, and then everybody else. So it's going to take time. I mean, everybody puts so much faith in science. We think we can just conjure up these wonderful cures at the drop of a hat, but we can't. Science is not exact, and sometimes even the cleverest minds take a while to fathom out what needs to be done, and we just need to have to be patient for that.
And following on from that kind of line of thinking, we have seen huge advances in science recently, haven't we? I mean, for example, vaccine probably would have taken a lot longer, let's say even 5-10 years ago, than it would today.
Yeah, that's true. When you look at the vaccinations that we've come up with for meningitis, for example, probably in recent years, meningitis was the disease that many parents feared most, because it did affect children very badly. And it took us a long time to get some of those vaccines, but now we've got vaccines against most of the worst strains of meningitis, but it took many years to get some of them. And the same will apply to this. This is a virus that it's very difficult to make antibodies to, we'll get there, but it'll take time.
The next question is from Michelle Crees. Now, she asks, should we be wearing masks outside? I also see a lot of people wearing plastic gloves. What would you advise?
Okay, with masks outside, I mean, if you're socially distancing, you're 2 meters apart from other people, the risk of the virus transmitting to you is very, very minimal. So what's the mask doing? If you are, however, face to face with patients who've got COVID-19, that's different. You know that they might be excreting the virus in their breath when they cough and they sneeze. So it's logical that a healthcare professional would have a good mask of high quality. There's no point having a mask of poor quality, because you're breathing in through the tops of the masks, the side of the masks, and underneath the mask. And if the virus is penetrating through the porous tissue itself, it's no good. So that's why it's really key that key workers have, healthcare workers on the front line have high quality masks that do give them the protection that they need. If you're wearing plastic gloves and you touch your face, everything that you've touched with your glove is transmitted to your face, just like if it was your hands without the gloves on. So if you touch something with gloves and then remove them and throw them away, then fine. But otherwise, you're no better off wearing gloves than you are your hands, and then washing your hands frequently.
The next question is from Paula Walker. Now, she asks, is it okay to use ordinary soap like Pears/Dove, etc. when washing your hands?
Absolutely it is. Absolutely. Soap. It's detergent that kills the fatty layer on the outside of the virus. Soap and hot water of any kind is absolutely fine.
The final question is from Quinn Janet. Now, she asks, why are we not spraying disinfectant, as the virus can live on surfaces?
The virus can live on surfaces, sometimes for up to 72 hours on things like hard plastic. Now, when you say disinfectant, I wonder what you mean by disinfectant. Really, what you need to be using is bleach, chlorine-based products. You need to be wiping the surfaces down, not just spraying stuff on top. Because think about it, if you spray a door handle, is it getting underneath the door handle that you put your hands around? Probably not. So you need to be thoroughly wiping down hard surfaces like that with a chlorine-based product and doing it on a fairly regular basis.
We've obviously seen in other countries spraying sort of public transport, roads, and things like that with disinfectant to kill the virus. That's probably what she's talking about. Why aren't we doing that in Britain?
Well, I'm not sure what they are using on those trucks and which areas they're spraying. For things like public transport, for example, it's really important that we deep clean all of those areas where many people are exposed to what other people have touched and sneezed and coughed on. Using disinfectant as lorries go down the streets, I'm not sure how widespread that disinfectant would disperse. Not sure if this is a psychological thing, whether it makes people feel better. Don't know how effective it is. So I'd like to see evidence that that's working, and I'd like to know what it is that they're using.
Great. If you enjoyed this episode of Ask Dr. Hilary, you can watch them every day, Monday to Thursday. If you want to ask a question, you can go onto social media using the hashtag #AskDrHilary, or you can go onto The Sun's dedicated website at thesun.co.uk/Dr. Hilary, or go to Talk Radio's website at talkradio.co.uk.